Urologist explains why baking soda improves blood flow in men over 60. It's a common experience, often occurring in the quiet moments of self-reflection or in front of the mirror, when a man might notice that things aren't quite as robust as they once were. This isn't always a sudden realization. For many, it's a gradual shift, a subtle erosion of fullness and responsiveness that has crept in over months or even years. What was once taken for granted now seems to demand more effort, or perhaps it doesn't respond at all. In those private moments, a whisper of resignation might surface, suggesting that this decline is simply a natural part of aging, a consequence of passing a certain milestone, and that this chapter of life is drawing to a close. However, it is crucial to pause and reconsider this deeply ingrained belief. It is often incomplete and, in many cases, demonstrably inaccurate. What if there existed a remarkably potent tool for restoring blood flow, enhancing fullness, and improving vascular responsiveness that had absolutely no connection to pharmaceuticals, injections, or the often exaggerated promises of expensive supplements? What if this powerful agent was already a common fixture in your kitchen, perhaps even residing near your everyday spices? The substance in question is none other than sodium bicarbonate, more commonly known as plain, simple baking soda. The initial reaction is understandable. How could something so innocuous, so associated with baking cookies, possibly contribute to significant improvements in physical performance and well-being? Yet, staying with this exploration will reveal 5 clinically supported and often overlooked ways in which bicarbonate can profoundly support vascular health. This journey will delve into the tangible effects on size, responsiveness, confidence, and reliability when blood flow is no longer compromised. For men in their 60s, 70s, and beyond, the sensation of a diminishing edge is a shared experience, but it does not signify an irreversible state of decay. The prevalent notion that once a man reaches a certain age, his body inevitably shrinks, weakens, and ceases to function optimally is a damaging myth. This belief, while widespread, is not grounded in biological reality. In a significant number of cases, what appears to be permanent loss is, in fact, a consequence of restricted circulation. Consider the analogy of garden hoses representing your arteries. Over time, the cumulative effects of inflammation, oxidative stress, and internal acidity can lead to a hardening and stiffening, akin to a kink in the hose. This constriction impedes the flow of vital resources, diminishes responsiveness, and can alter the visual and physical characteristics of tissues. The underlying structure, however, remains sound. It simply requires a clearing and rebalancing, not a complete replacement. This understanding forms the basis of an approach that bypasses miracle cures and unsubstantiated promises, focusing instead on optimizing the body's internal environment to facilitate its inherent healing and functional capabilities. It is within this context that bicarbonate emerges as a significant player. Our skin, far from being an impenetrable barrier, functions as a semi-permeable membrane. When tissues become burdened by accumulated metabolic waste and localized acidity, their natural elasticity is compromised. The intricate network of blood vessels beneath the skin's surface struggles to expand and contract with the ease they once possessed. By employing a localized alkaline soak utilizing baking soda, one can harness the principles of osmotic pressure to gently restore the tissue's pH balance. As inflammation subsides and the microvasculature relaxes, elasticity improves, leading to a natural increase in blood volume. This process can be likened to removing a tight rubber band from a sponge. Suddenly, its capacity to absorb and expand is restored. A simple yet effective method involves dissolving 2 tablespoons of aluminum-free baking soda in warm water and soaking for 10 to 15 minutes, 2 to 3 times per week. It is important to avoid this practice on broken skin or in the presence of active infections. Following the soak, a thorough rinse is recommended, and moisturizing the skin afterward can help alleviate any dryness. Remarkably, many men report not only physical improvements, but also a significant sense of psychological relief. as tissues appear healthier and respond more effectively, and often faded confidence begins to return organically and naturally. As the body ages, a natural decline in kidney efficiency can contribute to a state of low-grade metabolic acidosis. This condition is closely linked to issues such as muscle fatigue, stiffness, and the constriction of blood vessels. An acidic internal environment can cause vessels to tighten, thereby hindering optimal blood flow. Bicarbonate plays a crucial role as a buffer, helping to guide the body's internal pH towards a more balanced state. This buffering action signals the smooth muscle tissue within the vessel walls to relax, leading to improved blood volume, enhanced responsiveness, and a reduction in internal resistance. A straightforward way to incorporate this is by consuming half a teaspoon of baking soda dissolved in 8 ounces of water each morning on an empty stomach. The slightly salty taste is normal and can be made more palatable with a squeeze of lemon. For individuals managing high blood pressure or adhering to a sodium-restricted diet, consulting with a physician prior to implementing this regimen is highly recommended. Many men describe this internal shift as a feeling of renewed fluidity, akin to releasing a parking brake they hadn't realized was engaged, allowing for a more effortless and natural state of being. Understanding how alkalizing the internal environment contributes to opening vascular pathways is crucial, but equally important is addressing why many men, despite undertaking seemingly correct health practices, fail to achieve the desired results. A significant portion of individuals seeking to improve their well-being diligently pursue various health strategies, often incorporating supplements, nitric oxide boosters, beet powders, L-arginine, L-citrulline, and even prescription medications. Yet the outcomes may feel inconsistent, suboptimal, or fleeting. This is not necessarily because these interventions are inherently ineffective, but rather because their efficacy is contingent upon the establishment of the right internal conditions. Nitric oxide, for instance, is a master signaling molecule responsible for vascular dilation, essentially instructing blood vessels to relax and widen. However, nitric oxide is inherently unstable. In an acidic and inflamed bloodstream, it degrades almost instantaneously, rendering it incapable of fulfilling its intended function. Bicarbonate does not directly produce nitric oxide. Instead, it acts as a protective agent by buffering acidity and mitigating oxidative stress. This protection allows nitric oxide to remain active for a significantly longer duration. Consequently, instead of experiencing brief transient surges in nitric oxide followed by a rapid decline, sustained vasodilation, improved blood volume, and more consistent responsiveness become achievable. To optimize this synergy, consider taking bicarbonate approximately 20 to 30 minutes before consuming nitric oxide boosting foods or supplements. In this scenario, bicarbonate serves as the essential stage crew, meticulously preparing the environment so that the primary performance can unfold successfully. Furthermore, there is a lesser-known physiological process that many men are not privy to: inflammaging. This refers to chronic, low-grade inflammation that accumulates subtly over decades. Unlike acute inflammation that manifests as sharp pain, inflammaging quietly alters tissue structure, leading to fibrosis, the development of stiff, inelastic tissue. Even with adequate blood flow, fibrotic tissue lacks the capacity to expand properly. Research has indicated that bicarbonate can help reduce inflammatory markers such as C-reactive protein. As inflammation subsides, tissue elasticity improves, the capacity for expansion is restored, and overall comfort is enhanced. A strategic approach to using bicarbonate in this context involves a pulse method, consuming 1/4 teaspoon daily for 5 days, followed by 2 days of rest. This regimen supports internal balance without suppressing the body's natural buffering mechanisms. The physical improvements often precipitate a significant psychological shift. As the body begins to respond with greater predictability, anticipatory anxiety diminishes and the body transforms from a perceived adversary into a supportive ally. One of the most harmoniously balanced methods of incorporating bicarbonate involves its combination with lemon. This preparation consists of 8 ounces of filtered water, 1/4 teaspoon of baking soda, and the juice of half to 1 fresh lemon. Consuming this mixture approximately 20 minutes before breakfast can yield notable benefits. The potassium in lemon helps to balance the sodium in baking soda, while the citrate enhances the overall alkalizing effect. The bicarbonate, of course, effectively buffers acidity. Men who regularly utilize this combination frequently report improved morning responsiveness and greater overall consistency. Initiating the day in this manner sends a powerful message to the nervous system, reinforcing the importance of personal vitality and well-being. This mindset shift can cascade into better dietary choices, increased physical activity, improved sleep patterns, and a stronger sense of self-respect, with these positive changes compounding over time. To translate this knowledge into practical application, a phased approach is recommended. For the initial 14 days, the exclusive focus should be on optimizing internal chemistry through the morning drink. This phase is about deliberately clearing the internal rust without introducing multiple variables or chasing immediate sensations. From day 15 to day 30, continue with the morning drink and incorporate the baking soda soak twice per week. This allows the internal improvements to begin manifesting as enhanced tissue responsiveness. Even if no other step is taken, consistently adhering to the morning drink is paramount, as the internal pH shift represents the most impactful lever for improving vascular health. All other strategies can be considered additive. It is important to manage expectations realistically. Immediate restoration to the physiological state of a 22-year-old is an improbable outcome and can lead to disappointment. Instead, most men experience a gradual increase in warmth, a sensation of fullness, improved morning responsiveness, reduced anxiety, and more consistent performance, achievements that represent genuine success. This endeavor is not about pursuing fantasies, but about proactively protecting function, confidence, and dignity. Far too many men endure silent suffering due to the perceived embarrassment surrounding these topics. However, it is essential to recognize that these are not issues of shame, but rather fundamental aspects of human biology. Engaging with this information openly is a crucial step towards reclaiming one's vitality. Consider sharing this video with another man who might benefit from this knowledge, but may hesitate to seek it out. Aging does not necessitate surrender. Vitality is not a static destination, but an ongoing practice.